Hi everyone, hello, how are you doing? I hope everyone is doing good. So, welcome to another video of respiration and circulation. We have just begun the chapter. In the previous videos, we talked about the upper respiratory tract and the lower respiratory tract. And now, in this video, we will be covering the inhalation and exhalation of air, that is, inspiration and expiration. Okay, so let's begin. Basically, what is breathing? Breathing is nothing but ventilation, movement of air inside from the outside. Then the air enters into the respiratory system, into the bronchial tree, and then the alveoli. Okay, so the actions that happens, like you take in air, you give out air. So that is what inspiration, inhalation and expiration is all about. So inspiration is inhalation and expiration, giving out air, is exhalation. Okay, talking about inspiration, when you take in air, yeah, when you take in air, what happens? Your chest expands, the thoracic volume increases, right? And what happens? There is a pressure, sort of pressure, a contraction between the two muscles is set. Yeah, that is, the rib cage also moves out. And contraction of the external intercostal muscles expands the rib cage. So when there is a pressure, when the thoracic volume increases, there is a pressure or contraction. You can see over here, these are the intercostal muscles. Intercostal muscles are the muscles between the ribs. This is the trachea. Inside, you can see the lungs. Yeah. You can see the lungs over here. Inside, the lungs are then in this rib cage. Rib cage moves up and out, and this contraction of the intercostal muscles. You can see these muscles in between. Yeah, and then the diaphragm will also contract. There will be a pressure on the diaphragm which will contract and it will move down as your rib cage expands, your lungs expands, air is filling in the lungs. Okay, this happens when? During inspiration. So you need to remember the events. Rib cage moving up and out, lungs getting filled with air, the intercostal muscles contract, thoracic volume increases, contraction of the two muscle set, contraction of the external intercostal muscles, and the rib cage expands during inhalation, during inhalation of inspiration of air. Then also contraction of the diaphragm takes place. This expands the volume of the thorax and the lungs. So this, the whole thoracic cavity expands and the lung expands. Okay, there is a pressure. Now moving deeper down, when the air fills the lungs, it reaches the alveoli. Okay, so there is a sort of pressure in between the alveoli. There is a pressure which will decrease. The atmospheric pressure will decrease. You will see in the next slide what I'm talking about, the atmospheric pressure with respect to the air outside your body and the air inside your lungs. Okay, so basically atmospheric pressure, that is the pressure of the air. You are aware of this term, right? You have been time and again learning this term in chemistry and physics, mostly chemistry. So atmospheric pressure is greater on the outside. Okay, and it's inner, it's lesser. Okay, it's lesser in the inside, and therefore pressure which is greater on the outside and lesser in the inside, automatically the flow will be from outside to inside. This will force air into the respiratory tract through the air passage. Okay, so respiratory tract में air, it will go and then it will go through all your trachea, the bronchus and the lungs and the alveoli. Right? Because of the difference in the pressure of the gas, the air basically. Okay. So these are the events that will take place when you are taking in air. Okay. So you need to remember, when the lung volume increases, pressure decreases. See, when the lung expands, the already existing air which was there under pressure, that will become, loose, na? It will become less. So the pressure will decrease because the lung is now increasing in size. So the air which is there inside the lungs, they will not feel any pressure. Okay, so decrease in the pressure of the air, atmospheric pressure, the gas pressure, you can say, and the air which is present outside. So that is how it will move inside, and the air comes in like rushing in, like gushing in. Okay, that is how the changes will take place in your respiratory system when you are inhaling air. What happens when you exhale? So this is about the pressure. These are the term numbers that you can keep in mind. interalveolar pressure is 760 approximately. Okay, when you are inhaling, so it drops down to approximately 758. The pressure now decreases to 758. Outside it is 760, a little less. Okay, and when the lungs expand, so this is the pressure, intraalveolar pressure, which is now decreased, and then the atmospheric pressure then forces the air into the airways. Okay, initially it was at 760, then when you are inhaling, it drops down to 758. Okay, as you can see over here, contraction of the diaphragm. This is the diaphragm in the relaxed state. This is in the relaxed state. Okay, when you are taking in air, everything is expanding. You can see the arrow, the diaphragm will move downward, that is contraction will take place, and the pressure will decrease. And that is how the air will enter into the lungs in a force speed. Yeah. What happens when the air moves out? Exactly opposite. Rib cage will move down and it will, sort of decrease the volume. Diaphragm will relax and move up. When the diaphragm contracts, when there is a pressure from the lungs, the diaphragm will contract and it will become flattened. And when it is relaxed, when the air is out of the lungs, it will move up. You can see over here in the diagram. Now, the lung volume decrease. The lung will, which will increase. Now it will decrease. Inside pressure will also increase, and the air will move out. Yes. Now the pressure will increase because the lung volume has decreased. The diaphragm and the external respiratory muscles now will relax when you are exhaling air, when you are giving out air. Okay, elastic tissues of the lungs, the thoracic cage, okay, which was stretched at the time of inhaling air, suddenly they will collapse, they will recoil, and the surface tension collapses the alveolar walls. Okay, and then because of this tissues recoiling around the lungs, they will increase the intra-alveolar pressure. Just exactly opposite to what happened in inspiration. There the pressure decreased because of the expansion of the lungs. Here the pressure increased because of the contraction of the lungs. Okay? And then automatically air is squeezed out of the lungs, and that is how we give out air into the atmosphere. Okay, so this is the summary of inhalation and exhalation. Yeah, you can go through this. So during normal quiet inhalation, the diaphragm and the external intercostal muscles will contract, and when you are doing conscious inhalation, these muscles will also contract, which are mentioned over here. Yes, this leads to increase in the thoracic cavity, lung will expand, alveolar pressure decreases, then you inhale. Okay, yes, and when you exhale, all of it will now relax. The diaphragm, the intercostal muscle relax. Okay, yes, but when you are doing forceful exhalation, then abdominal intercostal muscles will contract when you are doing yoga or when you are doing some sort of exercise, daily exercise. So the abdominal muscles and the intercostal muscles will somehow contract. Okay, then you release air, the cavity decreases, the lung really comes back to its original size, and the pressure is increased to 762 mmHg. And then the cycle in and out of air and inspiration and expiration goes on. So have a closer look at the summary. If you find any difficulty in understanding the words, the mention over here is not required for you at this level because this is a chart and then this image is having these words also. So you can, for your further interest and further knowledge, you can search this and try to understand. If you are not interested, that's okay. It's not, you need not remember these names. Okay. So that's all for this video. If you don't understand anything, make a note of it and you can always reach out to me for your difficulty. So we have discussed inhalation and exhalation in detail in this video. In the next video, we will be talking about the exchange of gas. So as you can see, how we are moving step by step. First talking about the structure, upper respiratory tract, lower respiratory tract. How are they, where are they, their function. Then we moved on to, now we moved on to the inhalation and exhalation of gas. Now we move more deeper down. That is how the gas will take exchange of gas will take place at the alveoli. alveolar level. In this video, we saw the mechanism that more on the broader view, the changes in air pressure and the changes in the volume of the lungs and all that. Now we will see how the gas exchange will take place at the alveolar level. Okay, so that's all. Thank you. Take care. See you in the next video.